Hi there, my name is Dr. Linda Carlson. I'm a clinical psychologist and professor in the Department of Oncology at the University of Calgary. My area of expertise is mind-body therapies for people living with cancer. So I'm both a researcher in that area and I am also a clinical psychologist who delivers different mind-body therapies for people living with cancer. So I guess we should start by talking about what are mind-body therapies. So these are a whole range of practices that basically utilize psychological work or things we can do with our mind and our feelings that have an impact on our bodily function and often symptoms and side effects. So for example, when we do a relaxation exercise, it not only helps us feel calm, it also decreases the stress response physiologically that we're experiencing. So some of the common forms of mind-body practices that have the strongest evidence to support their efficacy are things like, for example, relaxation and imagery, fairly simple technique you can do on your own or with a professional. These are shown to help people decrease symptoms of anxiety and depression, improve coping. Another example is hypnosis. So either self-hypnosis or done with a professional in terms of medical hypnosis. This can specifically help people cope with pain, painful procedures, for example, like biopsies, even dental procedures can be done with less anesthetic if you use hypnosis, for example. Other popular types of mind-body therapies are mindfulness and mindfulness meditation. So this is a practice of retraining our minds, learning how to focus in on the present moment with an approach that is kind and non-judgmental. So there are many mindfulness training programs such as mindfulness-based stress reduction and a large body of literature showing that these kind of training programs can help people with cancer, again, decrease anxiety, depression symptoms, have less anger, and cope with side effects like fatigue, sleep problems, even pain. Other mind-body therapies that are popular are Tai Chi and Qigong, stemming from traditional Chinese medicine and Chinese martial arts, where the Tai Chi Qigong is more a movement-based practice, but also tied in with certain breathing exercises. And again, a lot of these mind-body therapies have similar effects in terms of helping us feel more calm, helping us cope, decreasing symptoms of anxiety. And often the best mind-body therapy to choose is really one that just appeals to you. In the research, they've rarely been compared head to head, but we know that any of these approaches are going to be beneficial across a wide variety of symptoms. Other things that are a little bit different than those ones we've covered are perhaps creative therapies. So this is things like visual arts, drawing, painting, expressive arts like writing or journaling, as well as movement and dance can also be a really good way to work through and process difficult emotions and help with coping. So thanks for listening. And if you have more questions or you want to find more information on these mind-body therapies, visit the SIO, Society for Integrative Oncology website. Thank you.